Welcome back to Pharma-Logic, where medicine meets meaning and we tackle the facts your arteries wish you knew. Today's episode? It's about something quietly lurking in millions of bodies around the world. No warning bells, no dramatic symptoms. But make no mistake, this thing can cause strokes, heart attacks, kidney failure, even death. We're talking about hypertension, aka high blood pressure, aka the silent killer. And no, that's not an exaggeration. It's literally called that in medical circles because people can have dangerously high blood pressure for years without feeling a thing, until something goes terribly wrong. So let's pull back the curtain. What exactly is hypertension? Why is it so common? How does it sneak by undetected? And most importantly, what can you actually do about it? Let's dive in. So, what is hypertension? Let's start simple. Blood pressure is the force of your blood pushing against the walls of your arteries. It's measured with two numbers, systolic, the top number, and diastolic, the bottom number. Think of it like plumbing. Your heart is the pump, your blood vessels are the pipes, and blood is the water. If the pressure's too high in the pipes for too long, boom, burst pipe. In the human body, that's a heart attack, stroke, aneurysm, or organ damage. Now, according to the American Heart Association, normal blood pressure is below 120/80 mmHg. 21-29 systolic? That's elevated. 130-139 systolic or 80-89 diastolic. That's stage 1 hypertension. 140+90+, that's stage 2 hypertension. 30+20+, that's a hypertensive crisis, and you should get to the ER like now. Here's the kicker. Most people don't feel any different whether their BP is 115/75 or 165/100. That's why it's dangerous, and why regular checkups matter so much. Why is it called the silent killer? Let's be honest, hypertension has a PR problem. It's not sexy. It doesn't trend on TikTok. There's no Hypertension Awareness Month parade with big inflatable kidneys floating down the street. But behind the scenes, it's absolutely wrecking people's health. High blood pressure puts strain on blood vessels, especially the tiny ones in the brain, heart, kidneys, and eyes. Over time, this leads to serious, sometimes permanent damage. Heart. Hypertension makes your heart work harder. That leads to heart failure, arrhythmias, and heart attacks. Brain stroke risk goes way up. Even small silent strokes, the ones you don't even know happened, can cause memory problems and dementia. Kidneys. Chronic high BP can scar the kidneys. That can lead to kidney failure and dialysis. Eyes. You can literally go blind if hypertension damages the small blood vessels in your retinas. And yet, millions of people have no clue their blood pressure is high. That's why it's the silent killer. It doesn't knock. It doesn't shout. It just quietly breaks down your body over years like a ninja with a grudge. How common is hypertension? Let's put it this way. If you're in a room with 3 adults, one of you has high blood pressure. And the older you get, the higher that number climbs. Globally, over 1.2 billion people are living with hypertension. In the US, nearly half of adults have it, and only about 1 in 4 have it under control. Let that sink in. Half. That's not a niche issue. That's a public health avalanche. And the scariest part, many people don't even know they have it because they've never had it checked. Or they think feeling fine means they are fine. Spoiler, blood pressure doesn't care how you feel. Hypertension myths. Busted. Let's bust a few popular myths before they cause more damage than salt on movie popcorn. Myth number 1. If I had high blood pressure, I'd feel it. Nope. Most people with high BP feel perfectly normal until they're not. The first symptom is often a stroke or heart attack. Myth number 2. It runs in my family, so there's nothing I can do. Genetics matter, but lifestyle plays a huge role. Just because mom had it doesn't mean you're doomed. You have control over many of the triggers. Myth number 3. I'm young and fit, so I'm immune. Sorry, no one gets a free pass. High blood pressure is showing up in younger adults, even teens, thanks to stress, poor diet, and sedentary lifestyles. Myth number 4. I'm on medication, so I'm cured. Blood pressure meds control it. They don't cure it. Stopping your meds without guidance. Bad idea. Really bad. What causes hypertension? Hypertension doesn't usually have a single cause. It's more like death by 1,000 paper cuts. But here are the big players. Too much salt. Excess sodium makes your body hold on to water. More volume equals more pressure. Obesity. Extra weight means more blood is needed to supply oxygen to tissues, which raises pressure. Lack of exercise. A sedentary lifestyle weakens your heart and blood vessels. Smoking. Nicotine narrows your arteries. Enough said. Too much alcohol. 1 glass of wine a night? Maybe fine. Binge drinking? Not so much. The stress. Chronic stress leads to long-term spikes in BP. Chronic conditions. Diabetes, kidney disease and sleep apnea all contribute. And yes, age, race and genetics also play a role. But your lifestyle choices often matter more than your family tree. Signs and symptoms or lack thereof. Here's the list of common hypertension symptoms. That's not a formatting error. That's literally the symptom list. Nothing. Hypertension is often asymptomatic, but in rare cases, especially during a hypertensive crisis, people might experience severe headaches, nosebleeds, chest pain, blurred vision, shortness of breath. And if that happens, get to an ER immediately. But again, most people have no symptoms at all. How to prevent or manage high blood pressure. Here comes the good news. Hypertension is beatable. You can lower your blood pressure or avoid it altogether with some practical lifestyle tweaks. 1. Eat smarter. The DASH diet, dietary approaches to stop hypertension, is basically the superhero of heart-healthy eating. More fruits, veggies, whole grains, less salt, sugar and processed food. 2. Move more. Aim for at least 150 minutes of moderate exercise per week. Walking, swimming, dancing, just get moving. Your arteries will thank you. 3. Watch the salt. Americans love salt, like really love it. But most of it hides in processed foods, not your salt shaker. Read labels and aim for 300 milligrams of sodium per day. 4. Lose weight. Even losing 10 pounds can make a big difference. It reduces the strain on your heart and lowers your BP. 5. Limit alcohol. Moderation is key. No more than 1 drink a day for women, 2 for men. 6. Quit smoking. This one's not negotiable. Smoking raises BP, damages arteries, and increases your risk of heart disease. Quitting helps immediately. 7. Manage stress. Yoga, meditation, therapy, saying no to people. Whatever works. Lower your stress, lower your pressure. 8. Check your blood pressure regularly at the pharmacy, at home, at the doctor's office. Know your numbers and track your progress. What about medications? Sometimes lifestyle changes aren't enough, and that's where medications step in. There are several classes. ACE inhibitors, ARBs, angiotensin receptor blockers, calcium channel blockers, diuretics, aka water pills, beta blockers. Your healthcare provider may prescribe one or a combo based on your health history. These meds can be life-saving, but they only work if you take them consistently. While I've been working in the pharmacy, I can't tell you how many people stopped their BP meds because I felt better. Please, don't play games with your blood pressure. Feeling good doesn't mean you're in the clear. Final thoughts. Hypertension is common. It's quiet and it's dangerous, but it's also preventable and manageable with the right mix of awareness, healthy choices, and sometimes medication. So don't wait for symptoms. Know your numbers. Talk to your pharmacist. Take your meds and treat high blood pressure like the serious condition it is, because it's not just a number. It's your life on the line. If this video opened your eyes or your arteries, hit that subscribe button for more smart, pharmacist-backed health insights every Friday at 5 p.m. Mountain Standard Time. Questions about blood pressure or meds? Drop them in the comments. I'm always here to help. This is Pharma-Logic, where medicine meets meaning. One silent killer busted at a time.